Good day, viewers. We're welcome to this exciting and new program, Sight Ed. Sight Ed is a health education program designed to enlighten every one of us on issues that relate to eye health. How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them. This is a maiden edition. Every week we intend to speak to different consultants, different specialists on different aspects of ocular health or eye health. And we also hope to have an interactive part with every one of our audience. That means you can send in your questions, comments as relates to the eyes, vision, problems with the eyes, and all of that. And in the second segment of every of this program, we will also be taking you through clips of films that have been specially designed to enlighten every one of us on eye health issues. I do hope you stay with us and enjoy the time. Today, this special maiden edition, we have an interview with a consultant ophthalmologist. As a matter of fact, he is the president of the Nigerian Society of Ophthalmologists, Professor CNN Nwosu. Please enjoy the interview.
My name is Sebastian Nwosu, the president of the Ophthalmological Society of Nigeria. I work at the Nnamdi Azikiwe University Medical School, where I'm a professor of ophthalmology and vitreoretinal surgeon. Well, let me answer this question by stating that many causes of blindness in Nigeria could be treated or prevented. And the common causes include one, cataract. Cataract is an affliction of the lens, the God-given lens. For us to see clearly, the Almighty has in His wisdom placed a transparent material in the center of the eye that is called a crystalline lens. Under normal circumstances, it's so clear that it allows light rays to pass through in order to hit the part of the eye where an image could be formed. However, under certain circumstances, especially as people get older, this clean, clear lens becomes turbid and opaque and wouldn't allow light to pass through. When this happens, a disease condition known as cataract is said to develop. And this is the commonest cause of blindness in Nigeria. Another important cause of blindness, which people will be surprised about, is even refractive error. A very important cause of blindness in Nigeria is glaucoma. One needs to emphasize it because while the other two I had mentioned, i.e. cataract and refractive errors, could be remedied easily and the person will be seeing well, glaucoma is the commonest cause of irreversible blindness. Once blindness from glaucoma sets in, there is little the physician, that is the ophthalmologist, could do to reverse that blindness. And so it is the commonest cause of irreversible blindness in Nigeria. Other causes will include diseases of the back of the eye, that is macular diseases, diseases that affect the nerve that connects the eyeball to the brain, optic nerve diseases. Then in children, infections, malnutrition, use of harmful eye medications, and what is called amblyopia, whereby there could be a problem which is not detected early and is not handled, and the eye stops seeing in spite of there being no obvious organic defect. Again, although not very common anymore, but situations of malnutrition, especially people who lack vitamin A, we also lead to blindness in children. We see it more in Nigeria when there is an attack of measles. But luckily, the National Program on Immunization is taking care of that. So, as I repeat, the common causes of blindness in Nigeria will include cataract, glaucoma, common in both adult and children, refractive errors, common in adult and children, then malnutrition. Each time I hear of displaced persons camp in the Northeast, I get worried. And actually, our members need to go there to look at the people there, especially the children, to make sure that they are not having some of this preventable blindness from malnutrition or from infectious causes. When somebody has an eye problem, you better go to hospital. One thing I didn't mention when I was talking of causes of blindness, because the question was common causes, is that of drug abuse. Certain drugs do affect the eyes and can lead to permanent blindness. I give you an example. Chloroquine, which is useful in treatment of malaria, if abused, will lead to blindness. We all should realize that alcohol is a form of drug, and if it is abused, will lead to blindness. Last year there was noise, or there was scare in Ondo State about people who, some died, some suddenly got blind. Also in Rivers State, it was because they took a dangerous form of alcohol, methanol. So these are things that get people needlessly blind, and we have to tell our people about that. So go to hospital, see a doctor. Even if the doctor is not an ophthalmologist, an MBBS holder, we examine you and then refer you to the appropriate place. Our people are very religious, but we have to be careful in doing certain things in the name of religion that could also damage our eyes. Some people put holy water into the eyes. That is dangerous. Holy water is hypertonic saline. In other words, water mixed with salt, making it highly concentrated. Being a highly concentrated solution, it will dry up the eye surface and render the person needlessly blind. Traditional eye medicines. Some of these things are made from caustic materials, things that will corrode the eye. Some of them are made from herbal preparations that contain fungus. And if you put it into the eye, it may lead to blindness. One problem of the eye that occurs in epidemic, sometime annually, is what our people call Apollo. That is acute hemorrhagic conjunctivitis caused by a virus. On its own, it can go. It is self-limiting. Within 10 days of onset, it can go. Just be washing your face with clean water, removing any associated discharge, it can go. Taking paracetamol tablets to reduce discomfort. But the trouble is that out of anxiety and panic, people go ahead to put different kinds of medicines in the eye. Some we put cassava water, some put human urine. We personally have encountered some people who using human urine that was infected with gonorrhea, and then got the eyes, snuffed off by the infection from the urine. And this is something that on its own shouldn't have caused any problem. Some put cassava water, some put petrol, some put kerosene. These are unnecessary. Again, if you are so much worried when this problem comes, go to any hospital or health center and see a doctor. Do not consult your peers in the beer parlor or in the marketplaces. And one thing is clear. Remember that every drug is a potential poison. And an eye drop given to you for a particular disorder, if it cures it, may be dangerous for the other one. Again, that brings me to the idea of going over the counter to buy unprescribed eye drops. Some of them are indeed poison and may worsen your condition. One of the first things medical students learn in the medical school is the prayer by Osler, for making the treatment of the condition, of the patient's condition, more unbearable than the disease itself. Good Lord, deliver us. Every medical student remembers that because it's written in the Grand Book of Surgery, Belly and Love. And so, for you as an individual, in an attempt to treat your condition, do not make it worse by going over the counter to buy what will make you blind. In other words, you have a problem, rather than enduring it, you now go and buy and impose on yourself blindness because you do not want to get to a health center for proper advice. On the issue of cataract, in Nigeria, our members have perfected the technique that the surgery for cataract can be done on you that day and you go home that day, with the latest technique that obtains even in developed countries. Glaucoma. That is a very frustrating disease for both the doctor and the patient, in the sense that when it starts, it is without symptoms, and so the patient may not know. But as the disease progresses, the vision becomes cloudy and smoky. And so, by that time, it may have been late. But an important thing to remember is that glaucoma runs in families. In other words, it could be inherited. And so, if anybody has a relative that has been diagnosed as having glaucoma, even if the person is not having any symptom, the advice of ophthalmologists in Nigeria is that the person goes to hospital at least once a year for evaluation, whether there are symptoms or there are not. Another advice is what we have to do to reduce the incidence of diabetes, because blindness from diabetes is also assuming an epidemic proportion amongst our people. We have to watch what we eat. We have to, for those who have been diagnosed diabetes, have to listen to their physicians, the endocrine physicians. And then once in a year, go and check your eyes. Being conscious of the fact that our relatives may be having a hereditary eye disease, being careful not to buy any medicine, especially when not prescribed by a trained professional, are things we will do to maintain good visual hygiene and to enjoy good ocular health throughout our lives.
All right, viewers, welcome back from that segment of interview, and I do hope you've understood all that Professor CNN Nwosu have spoken to us. Causes of blindness, and what we need to do in particular to ensure that we don't go blind, and for as many that have blindness, what they should do to see that they regain their sight. Now we're going to go to a second segment of this program, and as I said, it's going to be showing a film titled The Still Water. Glaucoma, as we've heard at a point in time, is the leading cause of irreversible blindness, meaning the most important thing you can do for yourself is to know if you have glaucoma early enough and then to take control of it before it leads to blindness. So please, the next few minutes, just watch the film, and then we'll keep watching the concluding part as the week rolls by.
Doctor in town?
Abil,
What did the doctor say?
the doctor said there's nothing anybody can do to make Baba see again. Not even the Onyibo.
Sorry, Sorry. I will see you when I return.
Okay.
Baba, now welcome. Sorry. Take care, though.
Brother, why is it that Papa is not seeing me again?
Jude, I don't know.
There are about 3 people that are blind in our village. Why?
Jude, I don't know. It's only the doctor who can tell us why people go blind.
I will make sure I become a doctor when I grow up and treat all the people that are blind in this our village.
Jude, that's very good. That's good. But you need to put this in your mind. You must read your books. Read your books well, okay? That's good of you.
Angie there.
Hey,
I was looking for you.
you here? Set?
I'm set.
Hey, wait for TJ.
I can't wait for TJ. I'll use the other car.
Okay, the key is on the table.
Okay, dear. See you later.
Hey, remember I'm traveling tonight.
Yes, sure, I remember.
And you have to drop me at the airport.
Ah, sure, will. My pleasure.
Take care.
I'll see you later.
Peter,
Yes, ma'am.
how long will it take you to chop this vegetable?
I'm sorry, ma'am. It's in the tree.
Now, did you know you've been chopping this vegetable in the last 1 year? Hey, girl, you're too sluggish. You irritate me. Now, get out of my sight. Get out of my sight.
Sorry.
Now, come on, cut off everything. Look at that. Hey, okay. Yeah, go outside, get me whatever. Just get out. Go and get me. No, this way. Just go.
Shit! What a mess! You, this man.
Sorry, sir, please. Yeah, sorry.
Are you blind?
TJ?
You must be out of your sense.
TJ?
I already have certificate. You can see my certificate working.
What do you have?
Are you blind? Can't you see my car?
Me blind?
Yes.
TJ?
Nonsense.
It's okay, it's okay.
You are not serious.
Blind,
Me
man.
blind?
Sorry,
Yes.
sir. Yeah, sorry.
Blind for nothing.
Me blind?
It's okay, TJ. It's okay now, TJ.
Oh.
It's okay, please.
Oh, you don't worry.
Get into the car. TJ, get
Me?
in. I said get into the car. My friend, get into the car.
I beg, take that thing away from this place, my friend. What are you riding? Take it away, my friend, and let me go. I will catch up with you. I will show you. Yeah, man. I will show you. I will show you.
All right, viewers, I do hope you enjoyed that clip on that film, Still Water. We hope to continue from where we stopped today at the next episode. This is where we're going to put an end to the program this time around. And I remain your host, Adepo Jufeyi, a consultant ophthalmologist and a professor of ophthalmology. We hope to see you next time on this same program, Sight Ed, and we'll be talking on another disease and we'll be interviewing another specialist. Thank you very much and see you next time.